So how did you get into kinesiology? Where did you come across it, and what stage were you at in your life?
Well, I was working as a physio, and I was really struggling. I was 30, and I thought, how am I going to work another 30 years? My joints were sore, I was getting burnt out, and I really didn't know what to do. So I was lucky that someone mentioned kinesiology, said it would be good for my own health.
Yeah.
So then I found Siobhan in Westward, and I work in Westward, so that was perfect fit. And then when I started the course, I was like, this is it.
You found it.
This is it. So it started with helping my own health, and figuring out how to de-stress and kind of not get repetitive kind of straining things, but also to help clients, you know, who had other things going on that the physio wasn't maybe addressing, like they had stresses or digestive things or
emotional,
other upsets that really, you know, was driving or not helping them resolve whatever their issue was. So that kind of reduced my frustration as well, because of course you want to help everyone. So it kind of gave me more tools to do that. But first and foremost, it's my own health. You know, improving it. And now I'm 36, and I'm kind of happy that I'll be able to work for the next 30 years, and I'm enjoying life.
Isn't that brilliant? It's changed your career and you love it.
Yeah, completely. And it gives you another passion. I mean, it works so well alongside physiotherapy. But again, it allows me to treat certain things that maybe the physio and the structural stuff won't address, because that's not their key issue.
They won't find it. They won't notice it. Yeah.
Because it's, as you said, emotional or digestive, or you know, some other past trauma or something else that really, you know, needs addressed before someone can move forward. And it's not that what we've done physiotherapy-wise is wrong or not the right thing. It's just there's more to it for that person.
Yeah.
You know, so for those kind of more complicated cases, or for those who've had stuff going on kind of chronically, it's brilliant.
You find it really useful.
Where it's coming from, and at least they have something to focus on.
So you're getting great feedback from your clients.
Absolutely, they love it.
And what sort of age group would you work on, or who are your clients?
Every age group, really every age group. I get a lot of teenagers and a lot of sports people, again, who have hamstring problems and back problems that are actually mainly digestive. So they've done all the rehab, they've done all the strengthening, they do nothing wrong in their kind of training programs. They're not overtraining, but they're sensitive to wheat, or they have.
It's as simple as that.
It's as simple as that. You know, or others who are, you know, really good performers, but at the same time they're very critical of themselves, so they're giving themselves grief all the time, and that affects the large intestine, so the back and the hamstring.
Isn't that interesting?
Well, you know, because they're so, you know, particular about their sport and performing very well.
Yeah, their own worst critic.
Yeah, but it has a physical impact on the body. So when they see that, they start to look at more the positive. How can I reinforce these, I suppose, positive emotions or positive statements to myself? Because otherwise I'm causing an issue, causing a weakness.
That's very interesting. So you would recommend it to people as a career?
Absolutely. Yeah. And I think for an awful lot of therapists, it is an adjunct, like an enhancement. It doesn't have to be either or, but it's like the things that you can kind of, the people that you get stuck with, or the things that don't follow the normal kind of recovery. It's brilliant for that. And it can work seamlessly really with it. It doesn't have to be an either or, but it's changed my outlook. Like I can imagine that I'll be working in my 70s, you know, and I don't worry about it.
Don't see it as a slog.
No, because it's not as physically demanding, and you find out very quickly what's going on, so you don't need to spend all that time with like elbows in and fingers in and all that, because you find it very quickly where it is. So you're not guessing, or you're not, you know, doing something and really working very hard.
And did you find it difficult to train in kinesiology alongside your job, or did you, like, how did you obviously were a full-time physiotherapist, then kinesiology came along. Were they night classes, or were they day classes? They were weekends, so you were able to fit it in, so you became fully qualified kinesiologist around your other job.
Absolutely. And initially, I don't think you know exactly how it's going to fit into your current practice, but you take the leap of faith that, you know, there's something about it that you want to learn, or there's something that resonates with you, and then you figure it out. You know, you learn it, and there's certain techniques that you're like, I'll use that all the time, and other things that doesn't work as seamlessly with my practice, but that's okay too. And so you can work full time while doing the course, and you have a huge, I suppose, advantage, because you know all the muscles, you know all the muscle testing.
Yes, of course,
You know, so you're learning a new concept, but a lot of the things are your bread and butter already.
That makes sense. Yeah, that makes sense. And what would have been what would be the biggest, or most dramatic result, from one of your clients, like that maybe someone was very skeptical or something, or you give an example of somebody that maybe came in with, like you said, one problem and it turned out to be a digestive problem, you had a bad back or you had a bad...
Yeah, absolutely. I had a man probably, like a week or two after we did the first part of the food testing, and he came in with the back and he was explaining it. I just thought, I'm not sure that this is structural. So I just asked him, would you mind if I tested a particular muscle, the QL, because it's related to the large intestine? And it was the issue. But it was digestive and not structural. Now, there was some structural elements with it. So I suggested to him that the wheat, we tested, and wheat and gluten was a sensitivity. And I don't know how many other clients he sent me, but a huge number.
Really?
Because it made such a difference. I didn't see him then for about 3 years. And the next time I saw him, he said, actually after that, I did get further testing done to see about the wheat and that. And he was actually celiac.
Was he? And he had never known?
No, but he didn't have back pain after that.
That's amazing.
So it wasn't that we were diagnosing that or anything else. It was just a case of his back pain wasn't in relation to movement. It wasn't in relation to something he'd done. It was very much digestive.
Kinesiology taught you that.
Yeah, we never addressed it fully. We would have alleviated some of the symptoms and released the muscle tension.
And he would have continued eating wheat, and he would have continued to be in pain,
depending how long it took to kind of restore back to where it started again.
And spend a fortune on back chiropractors and whatever. Yeah,
in the meantime. So it is, and it's really rewarding in that way because you know that you're targeting, and sometimes people will come in and I'll test all the kinesiology and be like, no, structural. So I'm back to my structural hands-on work that I would have always done. But at least you're not missing anything else.
Goes very well with your original career.
Absolutely. And at least, as you said, if someone's been doing lots of different therapies, they're kind of, you can direct them because their body is telling you what they need, and therefore you can direct what it is they need. Do they need to focus on their exercise and strengthening? Do they need to focus on their digestive system? Do they need to focus on their stress? So at least it's guided. You're not spending all this time that people don't have on things that aren't making a difference.
Brilliant.